We've been talking about what a bad allergy season it is, and these are very commonly used drugs. As you mentioned, we're talking about Zyrtec and Xyzal.
What if the allergy pill you've trusted for years suddenly turned against you the moment you stopped it?
So the FDA is basically putting out a warning that they are going to require prescribers to put on the labels.
Imagine waking up one day, thinking you're fine without your daily antihistamine, only to find yourself scratching uncontrollably from head to toe. Could a medication meant to give relief actually trigger a hidden reaction when you stop taking it? That's exactly what the Food and Drug Administration is now warning about. And it involves two of the most common allergy medicines on the shelf, Zyrtec and Xyzal. Welcome to BizWorld Explorer, where we uncover eye-opening health alerts, deep dives into everyday medicines, and what you really need to know before you take or stop any drug. If you or someone you know uses allergy medication, stick around because this episode could change how you view those little pills. The alert you probably didn't see in mid-2025, the FDA issued a significant safety communication. They found that people who stop taking long-term antihistamines, such as cetirizine, brand Zyrtec, or levocetirizine, brand Xyzal, may develop rare but very severe itching, medically called pruritus, within days of discontinuation. Here are the headline facts. These medicines are widely used for both prescription and over-the-counter (OTC) allergy relief. The FDA identified 209 global cases, 197 in the U.S., of pruritus after stopping these medicines between April 2017 and July 2023. The itching typically began within 1 to 5 days after stopping. For many patients, the only relief came from restarting the medication or tapering off instead of stopping cold turkey. Although the reaction is very rare compared to total usage, the reported cases include hospitalization, significant impairment, and severe impact on quality of life. In short, even a drug that's been safe for you may carry a risk when you stop it, and you may not know it until it happens. Why Zyrtec and Xyzal? The medicines behind the brands. Zyrtec and Xyzal are two of the most popular allergy medications in the world, both belonging to the same family of second-generation antihistamines. These drugs are designed to relieve symptoms of allergic rhinitis, seasonal and year-round allergies, and chronic hives without causing the heavy drowsiness seen with older antihistamines like Benadryl. Zyrtec, with the generic name cetirizine, was first approved by the FDA as a prescription medicine in December 1995. After years of safe and widespread use, it became available over the counter in November 2007, making it accessible to millions of people without needing a doctor's visit. Xyzal, known generically as levocetirizine, is actually a purified version, or enantiomer, of cetirizine. Think of it as a more targeted form of Zyrtec, designed to work just as effectively, but with potentially fewer side effects for some users. It was approved for prescription use in May 2007 and later released over the counter in January 2017. Both medicines work by blocking histamine H1 receptors in the body. Histamine is a chemical released by the immune system that triggers allergy symptoms like sneezing, itching, watery eyes, and hives. By blocking these receptors, Zyrtec and Xyzal stop histamine from binding, preventing or reducing allergic reactions before they intensify. Because of their effectiveness, quick relief, and generally safe profile, many people use these medications daily for months or even years to manage persistent allergies caused by dust mites, pets, pollen, or mold. This consistent long-term use, however, is exactly what the FDA's recent alert focuses on. The agency warns that people who suddenly stop taking these medications after long-term use might experience intense itching, a rare but documented withdrawal-like effect. It's not the allergy returning. It's a separate reaction caused by abrupt discontinuation. In simple terms, Zyrtec and Xyzal are trusted tools for allergy control. But stopping them carelessly after long use may cause unexpected side effects. That's why doctors now advise a gradual tapering plan instead of quitting cold turkey. What the data really shows. Digging into the numbers helps to clarify the real scope and nuance of the risk. Key statistics: 209 cases, 2017 to 2023, of which 180 were for cetirizine, 27 for levocetirizine, 2 for both. Median time to itching after stopping, about 2 days. Range, 1 to 5 days. Duration of use before stopping, in reported cases. Median approximately 33 months, approximately 2.75 years. Range from 1 week to 23 years. Most cases, greater than 87%, occurred in individuals who'd used the antihistamine daily for more than 3 months. Outcomes: some patients experienced disability, approximately 48, hospitalization, 3, self-harm ideation, 2, in that dataset. Relief: in many cases, restarting the medicine helped. Some people tapered off after restarting and avoided the severe itch. Important caveats: the reaction is still very rare compared to how many people use the drugs. The FDA emphasizes this. The mechanism is unknown. No clear risk factors, dose, age, gender, comorbidities, have been identified yet. Because these are mostly over-the-counter, usage patterns are variable, and many cases may go unreported. What this means for you: if you've been using Zyrtec or Xyzal daily for a long period, the risk of this reaction, while low, is not zero. If you plan to stop, you should be aware of it. Why this should matter to you? You may be thinking, okay, rare reaction, no big deal. But here's why it matters. For you, the allergy pill user, if you've used Zyrtec or Xyzal daily for months or years, stopping randomly might trigger unexpected trouble. Many users assume that stopping an over-the-counter allergy pill is totally safe, which this alert challenges. Knowing this allows you to make a plan, instead of a surprise, for stopping or tapering. If you experience sudden itching after stopping, you'll know the possible cause and can seek help. For your loved ones or anyone managing allergies, they might not realize this risk exists and assume allergies returning are just normal, not a withdrawal reaction. If someone you know takes these meds for years, you can share this info so they aren't caught off guard. For the broader health context, it raises questions about long-term use of safe, over-the-counter medicines and how little we might know about discontinuation effects. Label changes and warnings emphasize the shift from just start, stop anytime to a more cautious approach. If you're finding this eye-opening, please hit the like button and subscribe to BizWorld Explorer so you don't miss our next deep dive. Also, in the comments below, have you or someone you know taken Zyrtec or Xyzal daily? Did you ever stop and notice anything odd afterward? I'd love to hear your story. What should you do? Practical advice. Here's a practical roadmap you can follow. This is for information only, not medical advice. Always consult your doctor or pharmacist. Step 1. Review your current use. Are you using Zyrtec or Xyzal daily? For how long? Months? Years? Is it over-the-counter or prescription? Why are you using it? Seasonal allergies, year-round rhinitis, hives. Step 2. Talk to your healthcare professional, especially if you're planning to stop or reduce your dose. Ask, given how long I've used this, what's the best way to stop safely? Mention the FDA warning and discuss whether a taper is advisable. Step 3. Monitor for symptoms after stopping. Be alert for itching across your body, not just a rash. If it occurs within a few days, 1 to 5 days, of stopping, contact your healthcare provider. Don't ignore. While rare, some cases required medical intervention. Step 4. Explore alternative allergy management if needed. If you want to stop using Zyrtec or Xyzal long-term, talk about alternative strategies: nasal sprays, immunotherapy, allergen avoidance, other antihistamines with different profiles. Adjusting your overall plan means you're not dependent on a single pill indefinitely. Summary and final thoughts. To sum up, the FDA warns that stopping long-term daily use of Zyrtec, cetirizine, or Xyzal, levocetirizine, may trigger rare but serious itching. Although the risk is very low, the consequences for those affected were significant. The medications themselves are widely used and effective, but the discontinuation risk shines a light on the broader issue of stopping long-term meds. If you're using these drugs daily for months, years, don't assume you can quit without strategy. Talk to your doctor. Plan a taper if needed. Monitor for symptoms. Knowledge is power. By understanding this risk, you can make smarter decisions and avoid being surprised. Thanks for joining me today on BizWorld Explorer. If you found this video helpful, make sure to give it a thumbs up, hit subscribe, and ring the notification bell so you don't miss our next deep dive into hidden health and wellness risks. And if you enjoyed learning about the truth behind allergy medications, you'll definitely want to check out our previous video, Never Eat Here. Again, hidden restaurant secrets revealed. It exposes shocking facts about how some restaurants cut corners in ways you'd never imagine. So go watch that next. It's right here on your screen. Until next time, stay curious, stay informed, and take care of your health. I'll see you in the next video. Goodbye.